A 50-year-old male has fasting blood glucose of 160 mg per deciliter. Which of the following is true regarding a non-pharmacological treatment? Options were calories from alcohol should not be more than 10% of total calories. Total calories from fat should not be less than 30% of the total calories. Total salt intake should be less than 5 grams per day. And this diet should include more dietary fibers. First, fasting blood glucose of more than 160. Can this be called as a patient of diabetes? We'll see the diagnostic criteria. We'll call a patient as diabetes if the HbA1c is more than 6.5% or fasting blood glucose is more than 126 mg per deciliter or 2-hour plasma glucose is more than 200 mg per deciliter during an OGTT or random blood glucose is more than 200 mg per deciliter with symptoms of hyperglycemia. Our criteria of 126 is met, it is 160 here. So this is a patient of diabetes mellitus. So we'll see the pharmacological management in pharmacology. We'll focus more on preventive aspects and non-pharmacological treatment because we are dealing with community medicine here. Okay, what are the non-pharmacological treatment? Carbohydrates should constitute 50 to 60% of the total calories in diabetes patients. Proteins should constitute 15 to 20%. Fat should be less than 30%, and that too from animal fat. Saturated fat should be less than 10%. Cholesterol should be less than 300 mg per day. Fiber should be 25 to 40 gram per day, which is same as that of general population. Whereas in our option we were having, it should include more dietary fibers. No, even diabetes patients should have the same level of fibers. Sodium should be less than 2 grams, not less than 5 grams. Alcohol should be less than 5% of total calories, not less than 10%. And vitamins and minerals are same as that of general population. So when we are trying to counsel the patients and giving some diet plan, we should not suddenly decrease or increase the diet. Okay, it should be done in a gradual manner. It should not be altered more than 500 kilocalories per day at a stretch. So the answer here is total calories from fat should be less than 30% of total calories. That is correct. From alcohol, it should be less than 5%. Salt intake should be less than 2 grams, and it should include same amount of dietary fibers.